Hello, I'm Sung Park, prosthetic urologist practicing in Seoul, Korea. I was able to join the WMSM meeting held in Japan online. so actually the meeting was supposed to open an offline meeting in Japan, but because of the COVID, it had to be converted to the virtual meeting. I was going to do some, cadaver labs and other activities if was going to offline, but unable to do it. So this time I was just moderating a single course. Three of us, Dr. Bennett in the US and Dr. Kwang in Vietnam and me myself, three of us moderated course abstract session talking about erectile dysfunction treatment and other men's sexual health dysfunction. So among them, there was presentations about penile prosthesis, which I do. Also, external shockwave treatment for the erectile dysfunction by Dr. Alisa E. There is another doctor from Egypt, Dr. Arlan Allah, who talked about the new surgical modality with the premature ejaculation treatment. So all three of them were very impressive, especially presentation from Dr. Rajev was about how long we should put the drain after penile implant surgery. So they recommended 72 hours compared to the traditional 24 hours. So which was quite interesting. That was studied with the scrotal approach, and I think they may be right about the 72 hours, but it depends upon what approach you use. The other presentation, Dr. Alisa E's presentation, was about the ESWT with the ED treatment. The main theme was ESWT works better with those who have an erected penis, since shock wave transfers through the water, a fluid. Erected penis has more fluid in it, which makes the external shock wave transmits better. Basically, it is applied for those who respond with the trimix injection or someone who can have their own erection with the visual stimulations. And I asked about their goal with the treatment. ESWT is to reduce the dosage of the trimix injection, or rather than injection, they may use pills. So it's their goal. But still, ESWT is still quite controversial in the US and many other countries. So SMSNA statement clearly mentions that we doctors shouldn't charge our patients with the ESWT treatment because it's still an experimental treatment. So other regenerative treatment for the ED is included as well, like stem cell injections and all those stuffs. So me myself agrees with the SMSNA statement. And premature ejaculation surgery presented by Dr. Arlan from Egypt was very interesting. So it seems like a very promising treatment, and he mentioned that he had done about 2,000 or 3,000 cases, which has an excellent result. So I'm really looking forward to the full paper he is going to present in future days. It's a very interesting technique because in South Korea we do the dojinerectomy for the erectile dysfunction surgery, but in my own experience and with the other experiences, it's quite a limited treatment. So it only lasts 2 or 3 months in some patients. It lasts like 7 years, but their sensory will come back, and it has a limited effectiveness so far. But his method is something different, not cutting the nerves, but cutting the muscles down here. So yeah, it was very interesting presentations. But still, I wish we could all have the offline meeting rather than the online meeting, as if I was able to be there and talk with the presenters myself, I will be able to learn more about their, actual experiences and actual aspects of their presentations. So it's quite a shame that I couldn't attend it as an offline meeting. But hopefully, from next year, I think there will be more offline meetings. So I'm looking forward to that.